everyone. Good afternoon and welcome to the COVID-19 press conference. We're glad that you could join us today. Joining us today will be the Premier, the Honorable David Burt, the Minister of Health, the Honorable Kim Wilson, the Chief Medical Officer, Dr. Ayoola, as we call him, and Dr. Wesley Miller from KEMH, Bermuda Hospitals Board. We'll start off with the Premier. Good afternoon, Premier.
Good afternoon to you, Ms. Evans. Good afternoon to the Minister, the CMO, and the Chief of Staff. And good afternoon, Bermuda. I begin this afternoon by offering my heartfelt condolences to the families and loved ones of the persons we have lost since our briefing last week. The number of deaths we are seeing on our island during this outbreak of the Delta variant is a tragedy for our entire country, but especially for those who have lost persons whom they love and care about. Our thoughts and prayers remain with those in hospital, as well as those who are at home battling with the virus. During this outbreak, we have not only lost members of our community in the hospital, but also some in their homes as well. This afternoon, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide an update to the country on hospitalizations and vaccination status, guidance on what to do if you test positive, and other matters from her ministry. We're also grateful to be joined by the government's Chief Medical Officer, Dr. Oyinloye, and the Bermuda Hospitals Board's Chief of Staff, Dr. Wesley Miller, who will each give brief remarks. First, we'll hear from the Minister of Health, followed by the CMO, and then Dr. Miller before I close this afternoon's briefing. Minister of Health.
Good afternoon, everyone. Yesterday, I reported that Bermuda had experienced 10 more coronavirus-related deaths. And I, too, wish to share the sentiments of the Premier and express my deepest condolences to the family and loved ones of those persons. I also wish to indicate that I will continue to have and hold in my thoughts and my prayers those persons that are currently in hospital that are suffering from COVID. Bermuda is a small community, and these deaths are touching to all of us. We all know someone or knew of someone who has become very ill or who has alternatively died from COVID. I strongly urge everyone to please do everything you can to protect yourselves and your family from this virus. In 2021 alone, from January the 11th, when Bermuda's vaccine campaign began, to the end of Epi Week 38, which is up until the 25th of September, Bermuda has experienced 235 hospitalizations, and that does include repeat admissions, of which 215 or 91% of persons who have been not fully vaccinated, and 20% or 9% of those persons have been fully vaccinated. In addition, this year we have had 48 deaths, of which 39 or 81% were persons who were not fully vaccinated, and 9 or 19% were fully vaccinated. Sadly, the total number of deaths related to COVID-19 is 72, as I reported yesterday. As we all know, the Delta variant is easily transmissible and widely spread throughout our community. Everything we do should be focused on avoiding infection. If you do test positive for COVID-19, you must isolate for 14 days if you are not vaccinated, and for 10 days if you are vaccinated, even if you have no symptoms. As well, you must tell your close contacts that you have tested positive. If you are told that you are a close contact, then you must quarantine for 14 days if you are not vaccinated and 10 days if you are vaccinated. You must test to end isolation or quarantine on your day 10 or the day 14 quarantine. A negative test before the end of isolation or quarantine does not shorten the isolation or quarantine requirements. Protect your household members by separating from them during the isolation or quarantine period. Do not have visitors to your home whilst on isolation or quarantine. Be sure to contact your doctor for guidance. And if you do not have a doctor, the hospital has set up a phone number 239-2009 to assist with information on the proper treatment of your symptoms. Last week, we received 2,300 doses of the Pfizer vaccines, and I encourage anyone who wants to get vaccinated to register their interest for their first dose as soon as possible, and they can register it at gov.bm/vaccines. The Hamilton Princess and Beach Club has generously provided their location for free vaccinations. These pop-up vaccine centers are located in the Harborview Ballroom on the following dates: Sunday, October 3rd from 10 a.m. to 3 p.m., Friday, October 8th from 3 p.m. to 7 p.m., and Sunday, October 10th from 1 p.m. to 5 p.m. Complimentary parking is available, as well as refreshments and sweet taste generously provided by the Hamilton Princess. Medical doctors will also be there to answer any questions that you may have relating to COVID and the vaccines. Also, for those of you who have made the decision to get vaccinated, you can book an appointment or walk in at the King Edward Memorial Hospital Vaccine Clinic, which is open on Tuesdays and Thursdays from 4 p.m. to 7 p.m. and on Saturdays from 8 a.m. until 4 p.m. Regarding the booster vaccines, they will be available starting next week. At this time, the recommended target group for booster vaccines are, in this order: persons who are immunosuppressed, persons who are over 65 years old, including our care home facilities, a healthcare or essential worker, and then those persons over the age of 50. We are not currently administering boosters, as the Ministry of Health is currently working out the delivery details, and we will advise the public once appointments for boosters are available. Bermuda, please remember, we must look out for each other. We must act responsibly and adhere to the public health guidelines. This current outbreak is frightening, and to get through this, we must take responsibility for ourselves and for others in our community. Each of us has a role to play in stopping the spread of the coronavirus. Follow public health guidelines, wear your mask, practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. Thank you. I'd like to now introduce the CMO to provide a few remarks as well for this afternoon.
Thank you, Minister. Can you see me now? Yeah. Okay. Good afternoon, Bermuda. And I'd like to add my condolence to that of the Premier and that of the Minister for all the unfortunate deaths that we have seen so far. It's such a shame that we're seeing so much suffering at a time where much of this is preventable. But this is where we are, and we must find a way of getting out of the situation we find ourselves. Today, I'm going to talk about a couple of things that I have been informed has been circulating in our community, and a couple of myths that I believe it's important that we address head on. I would like to start first of all by some of the things that have been circulating in social media around home remedies that people can use in lieu of visiting their doctors, or indeed visiting the hospital when you have symptoms. There have been a cocktail of vitamins and ivermectin and things like that that people have been asked to take. Let me be clear, that is not a substitute for you talking to your GP. They know your medical history and are best able to advise you. And as the Minister pointed out, if you don't have a GP, the telephone number that has been generously provided by the Bermuda Hospitals Board is available for you to use. Please speak with a trusted health professional who can help you. Do not use this cocktail of medications. It will do you no good. And we unfortunately have been seeing quite a few people who are tested positive and have stayed away from healthcare until unfortunately it was too late. And in a few instances, people who did not even bother to test at all. We can't do better than this, Bermuda. Please consult a trusted health professional if you've tested positive to get the right medical information for you. Some of the things you should watch out for if you are, if you've tested positive is increased shortness of breath. That is a big red flag for you to consult your physician, and also the emergency room if you don't have a general practitioner. Many people will have been given pulse oximeters. These are things to measure the amount of oxygen your blood can take. If that is dropping, please consult your doctor quickly, and if you don't have one, at the emergency room. If there's new onset confusion, that is a sign for you to get your loved one to see a doctor or to go to the emergency room. I must repeat again, these home remedies are not useful in treatment of COVID. Linked to that, there's been myths around that the number of locally transmitted cases we have around the country is because of increased safe key testing of the unvaccinated. And that isn't true, simply because most of the safe key testing are saliva tests based, and we're not finding, the bulk of the cases we are finding are from our symptomatic testing centers. So it's not based on safe key testing. That's simply just not true. The other point I want to make is there's been things going around that vaccinated people are driving this outbreak because they're shedding virus or spike proteins of the virus. That's simply not true. There's no basis for this in biology. The vaccines don't contain any virus, and therefore people who are vaccinated can't be shedding virus. That's simply not true. Please speak again to trusted health professionals. And my final point is we do have evidence that some health professionals are perpetuating this myth, some of these myths in our society. Please remember your oath to first do no harm. It's important that we update us. I'm speaking to my colleagues now. It's important that we update ourselves with the most recent evidence around the management of this condition, and not inadvertently spread this falsehood and perpetuating these myths that is basically hurting us all. Stay safe, Bermuda. Thank you. I'd like to bring Dr. Wesley Miller, who's the Chief of Staff of the Bermuda Hospitals Board, on for his remarks.
Good afternoon, and I must thank Dr. Ayo for his remarks, and I echo the sentiments of the Premier, the Minister of Health, as well as Dr. Ayo in expressing condolences to all those families who have lost loved ones due to COVID. Unfortunately, it would be good if I could sit here and say, we have seen the end, or we're near the end, but we're not. The reality is that our numbers here at BHP have dropped only slightly, and we cannot say as yet whether it is a downward trend, although one would like to be optimistic in thinking that way. But while that is happening, we still have to care for these critically ill patients. We still have both the regular ICU and the 2 satellites functioning. And we also have non-COVID patients as well as COVID patients within ICU. What I would like to say to the public, however, is that for serious things, please do not stay at home. Those who have a stroke, even if you consider it to be minor, come and let us determine if that is minor or not, because it could well be the prelude to something bigger. And we're able to treat you, And if you require admission, we will find a way to make it possible. And if it is serious enough to go to the intensive care unit, we will also find a way to make it possible. We are stretched, but we will not be turning away anybody. And we do everything to minimize waiting times. So don't stay away, nor worry that you may come in with one thing and catch COVID, because we have a host of precautionary measures, including thorough cleaning and the appropriate use of PPE that would make that risk very small. So for serious things, please come. And in cases where you're not sure, you may call 239-2009. We're here to treat everybody who needs a treatment. Similarly, those who have gotten sick because they have failed to take their vaccines, we're not here to make any judgment. We advise and recommend the best, which should be that take the opportunity to have your vaccines, wash the hands regularly, wear your mask, and follow the public health advice on social distancing. But if you fail to do some or all of those and you get sick, we don't make a judgment whether it is your fault or not. We're here to treat. We're willing to treat. We do not discriminate. So if you need treatment, don't stay away. Don't feel embarrassed that you tried some alternative thing and it didn't work. If you did and you shouldn't have, come, we will treat you. Our job won't be to make any sort of judgment that you shouldn't have done that. Ours is simply to assess and treat as appropriate in the best way we can. And one of the things that on behalf of the entire staff, I would like to do is to thank those groups within the community who have been very supportive of the BHP throughout all this, those who have been supportive in their contribution to the vaccination program, those who have been supportive in contributing to and bringing meals for the staff, particularly those in hard-pressed areas where they can't possibly leave, or as you know, some of our staff have to do double shifts so as to help us in a situation of staffing shortage. So there's a heartfelt thank you, and certainly on behalf of the BHP and all the staff in those areas, we can't thank you enough. In terms of the number of people we have off work, we've seen a slight fall, so that currently we have 52 people off and who are either on quarantine or tested positive. And that's coming down from where we have in the region of 70 or more. We hope that is a trend. I'm not able to give you a breakdown in these in terms of those who are vaccinated and those who are not. That data I'm still waiting on. But certainly the week before, it was 75% of the unvaccinated. So again, even in terms of affecting our staffing, when people are unvaccinated, they're more likely to fall ill, more likely to be off work. That has implications for their own families and their friends, and it also has implications for the staffing of BHB and those who remain having to pick up the extra load. On the good news side is that we have seen an uptake of people coming through BHB. The lines are getting long again with young people coming to have their vaccines. I have also had inquiries from a certain section of our staff who had lower uptake rate. In fact, just yesterday, 3 individuals from that particular group with a low uptake were asking me about the booster dose and expressing their eagerness to have it. So we do have a few campaigners among them who are encouraging their family and friends and fellow workers to take it. From the point of view of our registered nurses and enrolled nurses, we recognize that there was a challenge, still remains a challenge, but things are improving. We had a certain point where they were only 50%. Then we struggled to get to 60%. Now the latest figures I got just this afternoon show that we have 76% of the registered nurses, be it both the enrolled and the casual, being fully immunized, and another 4% having their vaccination in process. That is, they've had at least 1 dose. So if we were to add those who have had 1 dose and those who have completed, we're now at 80%. I have every confidence that the 4% will go on to have their 2nd dose. The doctors have been in a good position, and the administrative staff, we're seeing a slight increase as well. They were well below the 50% mark. Now they're at 62% fully immunized and 3% in the process. I must reassure the public that in situations where required, in other words, in all the patient-facing activity, the staff wear appropriate PPE, irrespective of the COVID status of the patient, which very often in the beginning when the patient comes, we do not know the COVID status anyway. So we do everything that is possible to minimize transmission from staff to patients. And with that in mind, people should not be fearful of coming to the hospital. One is particularly concerned that some of the patients with strokes, serious heart problems, may stay away and suffer adverse effects. One is also particularly concerned that there have been a few people in the COVID group who came in dead on arrival and wondered whether or not it was due to a reluctance to come to the hospital or a miscalculation on their part as to how ill they were. Both are possible, but we would encourage people, whatever the situation, it's far better to come to see us and for us to say to you, it's not too bad, you can go home, rather than be in a situation where we think, oh well, if only one had come to the hospital. So for those in doubt, please call 239-2009. Those who have serious symptoms, call the ambulance or whichever transportation you can get to get here safely. Come, we will see you, we will look after you. And in closing, I must thank the Department of Health for the cooperation, the social services in helping us to move certain patients out so as to create space for us to have other patients. And last but not least, thanks to our staff from the allied health or dietitians, the physiotherapists, occupational therapists, the portering services or ambulance team, the nurses and physicians in all the various areas, because even those who were not part of the regular staff in the acute areas, having closed the clinics, they also volunteered to assist in the care of the critically ill patients. So we appreciate that and we thank everyone. And we also thank the Bermuda public, those who have taken up their vaccine, because in so doing, they have protected themselves, protected their families, protected their friends, and certainly they have behaved in the best possible way, not just in their own self-interest, but in the interest of others around them. Thank you.
Thank you very much, Minister of Health. Thank you, CMO, and thank you, Dr. Miller, for your work and the extraordinary work that is being done by your teams at the Ministry of Health, the Office of Chief Medical Officer, and also at the hospital. We implore persons that may have contracted the virus to follow the advice of the Ministry of Health and of what Dr. Miller has just shared. And if you require medical attention, do not hesitate to get in touch with your doctor or get in touch with the hospital. Our thoughts, prayers, and gratitude remain with our healthcare workers, nurses, and staff of the hospital and nursing homes who are working tirelessly in extremely difficult circumstances. We remain thankful for your dedication and for you getting up each day to answer the call to service, especially at a time like this when you are needed the most. What is also needed more than ever is a sense of community and caring for one another. There are families who are hurting that need our support during this difficult time. There are families with loved ones in hospital who are fearful that they too may endure loss in the coming days. We must pull together and support one another now and in the weeks to come. We've seen that new cases peaked about 2 weeks ago and that metrics are moving in the right direction. Our 7-day averages for positivity rates, cases, and real-time reproductive numbers are falling gradually. But we are a long way from being out of the woods. Our continued vigilance, care, and concern for each other's health and safety, and continued adherence to the rules in place must remain. We know from experience that 2 weeks after new cases peak, we see a peak in hospitalizations. And 2 weeks after a peak in hospitalizations, we typically see an increase the peak of deaths. Unfortunately, the reality is that while new cases may have peaked 2 weeks ago, we will see more persons hospitalized and more will succumb to this deadly virus and variant in the coming weeks. Those words are some of the most difficult words I've had to say as a leader, but they describe the harsh reality of the situation of which we currently face. And we also know that this outbreak is largely impacting the Black community, where vaccination rates are far below average and where underlying health conditions are disproportionately more prevalent. And that preliminary hospital figures show that 94% of persons who have been admitted during this outbreak are Black. Because of the fact that we are not out of the woods, the Cabinet has accepted the recommendation of the Ministry of Health to extend the nighttime curfew for at least a further 2 weeks. And that means that the curfew, which was due to end tomorrow, will be extended for at least a further 2 weeks. As has been stated by the Chief of Staff of the PHB, Chief Medical Officer, and also the Minister of Health, the vaccine remains the most effective tool we have against the coronavirus. It has saved lives. It is my belief that the only way to see the end of this pandemic is a continued increase in the number of residents who are vaccinated. The vaccine is available for anyone wishing to receive it. Please speak to your doctor and discuss if it's medically safe to do so. We have seen our vaccination registrations increase over the last few weeks, and that is welcome. To those of you who choose not to take the vaccine, please speak to your doctor on what you can do to boost your immune system against the coronavirus should you become infected, and take extra care in abiding by all public health regulations and guidelines. Last week, I spoke about the impact that this outbreak is having on our students. The government has prioritized the return of the students to classrooms. And tomorrow at 3 p.m., the Minister of Education, the Honorable Diallo Rabane, will provide the country with an update on the return to school plan, which will see some schools return to in-school learning as soon as next week. Students, parents, and teachers have been resilient, and we know all are eager to return to classrooms. We thank everyone for their patience while the government takes special care to ensure that we do this as safely as possible and the return to school does not set us back upon the path of seeing an end to this outbreak. As I close, tomorrow, October 1st, will mark 1 year since our country went to the polls and voted in favor of a government with steady leadership to see us through this pandemic. As the government elected by the people of Bermuda, we remain humbled to lead this country. My job as leader of this country during this pandemic has been difficult, but I recognize it is not nearly as difficult as the job of our doctors, nurses, public health professionals, and our incredibly knowledgeable and dedicated technical officers and public servants who helped shape and put in place the policies that have kept us safe and well-informed throughout. We understand that it has been an impossibly hard year for so many Bermudians. Our hearts remain heavy for those who have endured the loss of loved ones, those who are battling with the virus today, those caring for persons battling the virus, and for those businesses or jobs who have been impacted by the difficult decisions that we've had to make as a country in the interests of public health. We are all in this together as Bermudians. We can disagree on messaging, we can disagree on methods, we can disagree on opinions, but there's one thing that we can all agree on, and that is what we must do what we can to preserve and protect life. We can also agree that our enemy is not one another, but it is the coronavirus that we must unify in order to defeat. In closing, I ask those in our local faith communities to continue to pray for the families who have lost loved ones, continue to pray for those who have contracted the virus, and continue to pray for our healthcare workers and all those on the front line, those currently in hospital, and most of all, our island home. Thank you, and I will look forward to taking questions from members of the media.
And thank you, Premier. We have a number of reporters today with us. We will start with Diane Brewer from Bermuda Broadcasting Company. Go ahead, Diane, you're live.
Hi, I'm here. Yes.
You're live. Go ahead, Diane, you're live.
Oh, my apologies. Premier, as you stated earlier, 94% of those COVID patients in hospital are Black. What steps are you taking now to address this problem of vaccine hesitancy among Black Bermudians?
And just so I'm clear, the preliminary figures that we have from the hospital are 94% of those who have been admitted to the hospital during this outbreak. So I'm not speaking about current hospitalization numbers. But the fact is that we continue our advocacy, as has been heard from the Chief of Staff, the Chief Medical Officer, the Minister of Health, and ourselves. We continue the advocacy throughout the communities, and we do believe that it's having an effect, as we have seen a marked increase in the number of persons who have registered to receive the vaccine with over the last 2 months, 3,000 of those persons registering. And this month, I think we'll hit over 1,500 registrations.
Thank you. Once again, Mr. Premier, the number of cases under investigation, that is with no known source, has grown exponentially in recent weeks. Premier, your government imposed strong restrictions when the active cases and death rates were considerably lower. You've previously said the difference now is that many people are vaccinated and that we must live with the virus and keep the economy going. And yet government resources can't keep track of all the active cases. Please explain once more why you haven't locked things down amid a rapidly climbing death toll.
Thank you, Diane. I'll happily let the CMO speak to the under investigation cases and the prioritization of which his teams are doing in towards tracking cases, et cetera, and the reason why that number is where it is. But as I'd stated previously, I want to say maybe 2 weeks ago when I spoke to the country, is that any change or, we can send everyone home today, that will not change the situation which is happening currently at the hospital. This is due to actions which would have taken place in late August when the government did increase certain restrictions in the country. And by and large, in many cases and instances, or not many, in some cases and instances, those restrictions and challenges were not adhered to. And I think that's key to note. These cycles come in waves. So what we are seeing a result of today, unfortunately and sadly, in our hospital is due to actions which may have taken place over a month ago. And that is why it is important that we recognize that. And I understand that there's persons inside of the community who will feel that, the government may have taken stronger actions than otherwise. But I think that we have to recognize that as a country, as many countries in the world, we're going to have to live with the coronavirus. And the default position cannot be for the government to, take action. We have to accept personal responsibility, individual responsibility to care for ourselves, to care for our families, to protect ourselves, protect our families, etc. I mean, there are cases of which I've heard of, which I can only describe as negligent. You have senior citizens that are living in their homes over the age of 90, living with family members who are in their 60s. Those persons have gotten themselves vaccinated, but their parent who's living in their house over the age of 90, they have not bothered to take them to get the vaccine. The virus comes to the house and the parent succumbs to the illness. We have to accept responsibility. That cannot be something where the government has made it available, where persons will take care of themselves, but will not take care of family members inside their own homes. And it is important that we understand that this pandemic will continue for the foreseeable future, and we must do our part individually to do what is necessary. As we said, if you elect to take the vaccine, get the vaccine. If you are vaccinated, ask your elderly family members if they are, and if they aren't, take them to go ahead and get vaccinated, please. And if you do choose not to, obey public health rules, obey public health guidance, and speak to your doctor about what you can do to boost your immune system in the case that you contract this virus. And I'm happy for Dr. Ayoola to speak to the contact tracing efforts.
Thank you, Premier.
Hello. As I've said on a couple of occasions in the past, the numbers of new cases are way beyond what we can keep up with, even at the best of times, and not particularly now that our teams are significantly restricted in terms of the number of staff we have available to us at any given time. So at the moment, we are only able to prioritize congregate settings like schools, large events, and also healthcare settings and critical national infrastructure. And that's what we have been able to cover. We cannot offer the level of service that will be able to contact trace every single case. It's simply not possible.
Thank you, CMO. My third question, once again, please, for the Premier. In the last hour, another of our Bermuda Broadcasting employees witnessed a body being loaded into a refrigerated shipping container. What's happening on the island right now is truly unprecedented in modern times, and Bermudians are looking for reassurance that this current wave will pass. The death rate will fall, active cases will drop. What is the outlook as you see things right now?
Thank you, Diane. As I indicated in my statement, we have seen that, the peak in cases was about 2 weeks ago, I want to say on September 14th. We've seen a gradual decline both in the number of new cases, positivity rates, and of course our real-time reproductive number has decreased. We are continuing to expand our testing capacity. But as cases may increase and peak, there's always a lag between an increase in hospitalization and an increase in deaths. And some of these deaths, as I said, are tragic. There are situations where we have persons, maybe in nursing homes whose families have elected not to have vaccinated and who do not resuscitate orders. It is incredibly tragic. And it is not a situation of where we want to be. It's not a situation of where the thought of the morgue being overflowed, the section of the Public Health Act being invoked to allow direct burial is not where we want to be. Insofar as reassurance, the fact is that due to the collective actions of the community, adhering to the guidance once persons, for lack of a better word, became fearful of what was actually taking place and observant of the directions, the pleadings from the government. We have seen transmissions fall, and we have, as you've seen, see the metrics turn in the right direction, but we are far from out of the woods. There will be continued hospitalizations, as all of us have said, and there will be, unfortunately, increased deaths as this wave goes. But I think it's vital that we certainly look towards the future, look to care for those and provide support for those families who have lost persons, encourage persons to make sure they get protection for themselves and their families, to protect against future waves, as there may be future waves, and to make sure that we do what is necessary for all of us collectively to recognize the tremendous emotional scar which this will leave in our country, and not to forget the fact that this is not a hoax. This is not one of the other pejoratives, and that we have to take this thing seriously to preserve life. So yes, it is incredibly tragic, and our heart goes out to the families who are dealing with this unprecedented situation where the challenge of saying your final goodbyes are not what we as a community are used to.
Thank you.
Thank you, Diane. We appreciate you joining us today. Next, we'll ask Maya Palacio of Media Maya to join us. Maya Palacio, Media Maya. Maya. And you are live, Maya.
Good afternoon, everyone. My first question is for Dr. Ayo. It's, how will the booster shots play a role in vaccinated status? For example, will you still be considered vaccinated if you do not get the booster?
Hi, Maya. Yes, is the direct answer to your question. The most important thing from a protection of the public point of view, from the health of the public, is getting your primary shots, and that's your first and second shots. Boosters are primarily designed for people who are less able to mount adequate immunity to the primary shots, and also where we think that the immunity from the shots is beginning to wane. But evidence from large studies and from other jurisdictions show us that the residual protection that is still there after close to a year of the vaccination is still quite good for most people. But there is a section of the population where that isn't as good. And this is mainly for the immunocompromised, or for people with health conditions that doesn't allow them to have a strong immunity as the rest of us. And that's why we're prioritizing those people for our booster shots.
Thank you very much. My next question, I believe, would be for you, Premier, and it's coming from the community, is why hasn't the government mandated work from home?
Thank you. I think what's important is that we must recognize that as we continue to move forward and live with the coronavirus, one-size-fits-all solutions don't necessarily work. We set out the parameters for persons to go ahead, and there might be a small office of 3, adequately spaced with individual offices where people can work there, and they're all observing the rules, and they've all protected themselves. So it's not necessarily in the case an instance where there's a one-size-fits-all. What must be reminded is that there is the ability, if an individual feels that their workplace is unsafe, where they are being required to come to work and they do not believe that adequate precautions are being taken, people are not wearing masks indoors, people are not following the public health guidelines, that they are welcome to go ahead and to report that under the law to the Ministry of Health under the Occupational Safety and Health Act. And certainly those things can be investigated. But we have to be able to accept responsibility for where personal responsibility inside the country, and make sure that we are taking the steps to keep each other safe in all circumstances and instances. And I know that whether it's the government or private organizations have made the adjustments which are necessary to keep themselves and their staff safe.
Thank you very much. My next or last question that I'll select is, are there any plans to include more rapid testing, as it seems the system is strained at the moment? And are there any plans for opening maybe the South Side Urgent Care as an emergency COVID center?
I'll let Dr. Ayoola, the Chief of Staff, speak to those two issues.
I can speak to rapid testing. Oh, sorry, Dr. Miller, I'll let you start. Yours is more important.
No, Dr. Ayoola, if you speak to the rapid testing, I'll answer the second part. Yeah.
Okay, well, thank you very much for that, Dr. Miller. So for rapid testing, yes, we're working through a process at the moment to allow more rapid testing to occur, antigen testing to occur on the island and as part of screening program. It's important, I should mention that these are not diagnostic tests, they're screening tests, so they would allow us to know rapidly whether people are positive or not, and allow businesses and schools to go on more with less interruptions. But the standard still remains PCR tests, and that would be the basis of our most public health actions. And so I would like to implore people, I know that there's quite a few antigen tests that's available on Ireland at the moment, that does not replace the public health order that you receive based on the gold standard PCR testing. Thank you.
And in answer to your question as to whether we would open the Southside Center, we have a different plan of action which is in place. The Southside Center, we're encouraging people who have less severe problems to go and use the urgent care center so that we can keep the emergency department for what it is meant to do, looking after the more seriously ill cases. We also have enough space, and we can create more space, and we have created some more space at BHB beyond the 3 acute wards, so that if we had to accommodate more COVID patients, we can accommodate them. So space is not our challenge. Our real challenge is not having enough staffing, and particularly nurses. We didn't have enough ICU nurses, but what we did, we scurried from wherever we could get the best highly trained. So an early move was to close the operating theater, because there you have some of the most highly trained, highly skilled nurses. They can manage anything. And the nurses in the recovery area, the PACU, they're highly skilled. They can just do a whole range of things. We also had some nurses with those skill sets who were in other outpatients clinics. So we pulled them in as well. Those on the ward who had those skills, we shifted them with some of the ones from the clinics, even from the Department of Radiology, where we found that we had somebody with ICU training and skills. We pulled that person and then substituted with someone who came from the community and could assist with that sort of work. By having the COVID patients at King Edward, those who need admission, we also have the situation that if the patients were to deteriorate, we can take them to the ICU, either the main one, which is full or currently full, or to the 2 satellites that we have created. So we have the opportunity to offer better management for them rather than if we were to manage them at 2 sites, because space is not our problem. The real problem is staffing and how we manage to do things to get the staff to work. The good thing is that the staff, as well as the unions, have been very cooperative, and therefore people have worked double shifts without complaining. So that's like working 16 hours. but without making a fuss, because we need to get through this. So in doing that, we managed to cope. But the challenge would be if we begin to divide and try to manage in two different centers, we would need more staff. And also, if we had them at the urgent care center and they were to deteriorate rapidly, we may not have enough time by ambulance to transfer them from there, because some of these COVID patients, the desaturation, in other words, their oxygen can fall so sudden that you have to intubate and ventilate them. It can be done in an ambulance, but it's really much less than ideal. So that's why we have them there. But we don't need to use the urgent care center for the COVID patients, but we are using it for the more minor thing which it was meant for. And I'm pleased to tell you, Maya, that the public has been cooperative, and so we're seeing increased usage of the urgent care center.
Thank you very much. Those are my questions.
Thank you, Maya, Media Maya. Up next, we have Jonathan Bell from the Royal Gazette. Jonathan? Jonathan, you are live.
Thank you, Tina. And there we go. Can everyone see me and hear me? Looks like it. Well, good afternoon, everyone, and thank you. Health Minister, I guess I wanted to jump in first with the demographics of people recently who've been admitted to the hospital and who we've lost, particularly age range. You've given some information on vaccination, but given the high numbers, I think privacy is pretty well cloaked with this one, but particularly age ranges and any other demographic details you can give us.
Hi, Jonathan. With respect to and this represents the figures from the 11th of January to the 25th of September, which is our last EPI week, concerning the vaccination status, and these are the persons that have been admitted to hospital. 215 were not vaccinated. 20 were vaccinated, and so that's a total of 235. And with respect to the deaths, out of the 46 deaths, 39 were not vaccinated. 7 were fully vaccinated.
What can you tell us about their age ranges? That's one I'm particularly curious about. A lot of people seem to be.
Sure. For the ones that were fully vaccinated, the age range was greater than 40 years to over 80 years. And for the ones that were not fully vaccinated, the age range was greater than 20 years to over 80 years.
Thank you. I guess following on from that, I believe I'm making that we've had five more deaths from vaccinated people since last week. What can you tell us about those people in terms of comorbidities, suppressed immune system, or old age playing a factor in that?
Jonathan, as was reported last week by Dr. Miller, he indicated that there are issues of privacy, so that it would be totally inappropriate for us to disclose personal circumstances surrounding an individual, save for the fact that the person died with COVID. It's totally inappropriate for us to disclose that type of information. I'm sure you could appreciate that.
I've got you.
Minister, if I can just jump in, if you don't mind, please.
Yes, of course.
Yeah, no, it's not true. We have 5 vaccinated deaths since the last one. It's 3 extra. And yes, it's as the minister said, it's difficult to talk about individual cases. This is matters for the family to share if they choose to. But I think it's safe for us to say that the deaths in the unvaccinated is happening at younger age groups than we'll find in the small number of deaths that we in the vaccinated group. So the unvaccinated are dying at a younger age than the people who are vaccinated.
Thank you, Doctor. Okay. I counted those up wrong, so understood. 3, not 5. It's 3. Lastly, and I think this could be for yourself, Health Minister, are you able to tell us how many people we have in quarantine at the moment?
When that question was last asked and they did a calculation, and that was probably about a week or so ago, they said, well, over 10,000 people. If you know that there's 1,400 people that are active cases, and if each individual lives with 4 people and or has, a communal, family units, but at the last count, it was well over 10,000.
Would 15,000 be a reasonable supposition?
I'm not going to agree or disagree, but the last count when they did provide those numbers was around 10,000.
Thank you.
All right, thank you, Jonathan. Stay on, we'll come back to you if we have time. Okay, great. Up next is Earl Basin. Earl from Island Stats. Earl, are you with us? You're live.
Oh, good afternoon. Premier, anyone visiting or driving across Horseshoe Bay earlier today would have seen a large number of people gathered. With it being a public beach where vaccinated and unvaccinated people are allowed to mingle openly, who's responsible in ensuring that all the rules are put in place, similar to the local bars and restaurants as well as sports clubs, are adhered to?
Those responsibilities for enforcement lie with enforcement agencies, Earl, and I would hope and would assume that persons who may be gathered in public spaces or public parks are adhering to the guidelines which have been established of physical distancing, and if you are within 6 feet of someone who's not from your household, that you are wearing a mask.
Okay. Again, Premier, we often hear you talk about we are guided by numbers. And as you know, sports is a big thing for the country and as well for me. But what numbers are needed for locals to be allowed to return to sports?
I believe that the Minister of Youth, Culture, and Sport will be addressing that as we go forward. But what we need to make sure is that we're in a stable position and situation where those things can resume more quickly. Our priority is the return of school. And then after the return of school, we can move to other resources, to direct healthcare resources for things such as sports and others. I think that we will admit, though, there's people who may think that sports is vitally important. I think the most important thing that we can do is turn our attention from stabilizing this position at the hospital to moving to make sure that we get our students back into the classroom safely.
Okay, and the final question is, with October the 11th and 18th fast approaching, those 2 dates are significant as Philadelphia arrives one day and she'll be celebrated on the other. Our plans are going ahead with different celebrations, but like the triathlon where crowd problems was one of the reasons for the cancellation of the event, how do you plan to keep crowd to a minimum on these event days, that the celebrations will be hosted?
Thanks. I don't have the specific details. I know that the Minister of Youth, Culture, and Sport spoke about some details in the Senate yesterday when this matter was being debated. But I know that the Ministry of Youth, Culture, and Sport will give out the information for how the celebration is going to happen. But as with all things, the celebration must be in accordance with the rules and laws which are laid down. And that means that if it is an outdoor space and outdoor events, that means that persons will need to be masked unless they are not within 6 feet of others and are with people from their household. So, I mean, this is where we are currently, and it is important that we minimize the transmission or the onward or continued transmission of the Delta variant in our community, which has wrought so much pain and anguish in so many families.
That's my 3.
All right, thank you, Earl. Stay on. We'll see where we're at with the questions. We're going to have Trevor coming up next, okay? Thank you. Trevor Lindsay, TNN. Are you there, Trevor? Waiting. Trevor, you're live.
Good day, good afternoon. Yes, my first question, I would take this is for the doctors. What do you feel is the determining factor or factors to whether a person survives a bout of COVID? We've had many people pass and some have survived. What are the determining factors for survival?
Trevor, that's a very interesting question because many factors will determine whether an individual survives or not. Probably the most important is the preventative mechanism because prevention is the best way. But those who, for whatever reason, there was a breach in prevention or it was ignored, and they do get COVID, the next thing is your line of defense. And it's the immune system within the body. Now, there are some people, and you find that in practice, as a general rule, it doesn't hold for everybody, but as a general rule, the younger people will have a better immune system than the older folks. So that's number one. Number two, the overall health. The younger person, say if you were to take a 20-year-old or an 18-year-old, that person is less likely to have high blood pressure, less likely to be diabetic, less likely to have severe kidney disease, less likely to have had a serious bout of treatment with cancer and be on chemotherapy, less likely to have had a kidney transplant, and so forth. So that person who is fitter has a better chance of surviving than someone else. So they start off with a better hand of cards. The person who is hypertensive, diabetic, it also depends on how long they've been hypertensive, how long they've been diabetic, and how well controlled it is. Why does it depend on that? Because depending on how long the person has had high blood pressure and how long the person has had diabetes, it now begins to affect the blood vessels. Now the blood vessels take oxygen and nourishment to every part of the system. But if you have blood vessels that are partly clogged up, some of the small ones blocked off, so you have to use alternative pathways. What it means, for instance, if that person were to get a pneumonia, so the lung isn't picking up as much oxygen as it normally would, the blood system cannot distribute it properly as it normally would because the vessels are partly clogged, like you have clogged up pipes. They're also frail and they're more brittle. That individual, if you can't get oxygen to the tissues and the cells in the body, the cells fail. So if it is the kidneys get worse. If it is the lungs get worse, the brain gets worse. So the whole system begins to shut down. So when people die, for instance, from COVID, generally what happens is a multi-organ failure. The system is shutting down. And that is why we talk about the comorbidities, because especially with diabetes or high blood pressure, if you have them for a long time, and if the control wasn't particularly good, you already have organs which they're not firing on all fours. They're not as good as they should be. So there's not the reserve that they can rise to a challenge of, say, a low supply of oxygen. Similarly, there's another side to it, the immune response, because the body, whenever you come into contact with viruses or bacteria, produce certain substances that we refer to as antibodies. The best way of thinking of them are thinking of them like the policemen who walk the streets, patrol to make sure everything is all right. But there's also another set of cells that produce these antibodies, and they produce it based on an information system. Then there's yet another set of cells that are like the cruise missiles. They come out, they mean big business. What happens is that as someone gets older, the system doesn't function as well anyway. So if you have a system that doesn't function as well when they get older, or similarly, if they've had chemotherapy for, some serious cancer or something like that, the system isn't going to function properly either. So if you have had treatment for cancer, you've had a kidney transplant, which isn't working too well because you have to be on a whole lot of medication to prevent it from failing, and there are all the other things taking place. If that person gets COVID, he or she has a greater likelihood of a bad outcome versus the 18-year-old who is fit and well. But having said that, it doesn't mean the 18-year-old won't get into any problems. It just means that they have a better chance, because supposing that 18-year-old was somewhat unusual and was born with an immune system that wasn't so good, now that 18-year-old could have as bad a chance or worse than a fit 40-year-old. So there are many factors, but the key thing has to do with how well the immune system works, as well as the comorbidities. Now with the vaccine, what the vaccine does, the vaccine helps to prime and direct the immune system. So the vaccine said, come here, boy, you need a little help. This is what I'm going to do. I'm going to show you how to make bread. So now the system learned, and it is capable of responding. And that is why, contrary to what some people are saying, the current vaccines that we have, none of them use the virus, but it uses a very sophisticated information system that prime the system so that it can respond appropriately to make these antibodies, as well as to make the other things like the special T cells, those which are the big guns. So you have a whole range of line of defenses triggered by the vaccine. But the vaccines are not viruses. And sometimes you hear people say, oh, the vaccine is causing problem. People are shedding viruses. Not really, because we're not giving any virus in the vaccine at all.
Thank you. Premier, this question is for you as the tourism minister. How would we shape our tourism message in the midst of this pandemic, particularly as we are red listed by the CDC and other major countries?
Thank you, Trevor. I can't necessarily speak to red listed by other major countries, but what I can speak to is in regards to our major tourism market, and that is the United States. Certainly the level 4 ranking from the United States Centers for Disease Control is not welcome, but that is based upon the local transmission demographics that exist inside of the country. What we have seen over this outbreak, as I reported last week, is that only 1 in 555 visitors who come to the country have tested positive while they are here on island. And that is a very low amount. And if we were to rate the United States on the same rankings at which they rate us, the United States would certainly be a level 4 jurisdiction as well. So the fact is that Bermuda is safe for visitors. Bermuda is a safe place to enjoy as long as you are following the guidelines which have been put in place. And so for places and businesses and visitors and other persons who follow the guidelines that have been put in place, Bermuda remains a safe place to visit. And that is the messaging which we are seeing. But certainly our hotels have been affected. Certainly our restaurants have been affected. And our most important thing that we have to do is to make sure that we support those hotels, support those restaurants. And I had a meeting with the CEO of the Bermuda Tourism Authority yesterday to make sure that we are reinforcing the message which goes out to the visiting public.
Thank you, sir. My next question. We've seen our only hospital overrun previously by a flu outbreak and now this pandemic. Will the government and or the Minister of Health now plan a review of our ability to handle future outbreaks of diseases? B, could we not consider an interim facility plan if not this is already in the works? Meaning a review of our healthcare system as we stand right now.
Happy to defer.
Trevor, are you referring to as it relates to COVID?
Yes.
Well, as the government's always indicated, we did not want to skip to a point where we would see, our healthcare system overrun, and that's exactly where we find ourselves. We've spoken a lot about personal responsibility. I think it's important for people to recognize, as has been stated previously, the only way we're going to get out of this is through immunization. And the COVID will hit dead ends once enough people are immunized. And as I spoke yesterday to Diane Brewer, there are a number of individuals, because of their own medical circumstances and or age, that are unable to get the vaccine. So we as members of the community owe it not just to ourselves, but to our fellow man and woman to be vaccinated, because we're going to continue to have these challenges, and we're going to continue to have variants and waves. And I know everybody is exhausted from having to deal with this, and it's going to be a regular occurrence, but we need to be vaccinated. We need to talk to our physicians and get vaccinated.
I guess it's my third question.
All right. Thank you, Trevor. Appreciate it. We're going to try to get one more question from each of the reporters see what we can do in the next couple of moments. We'll start with Diane Brewer, see if we can get Diane get in and out to the last question. See what we can do in the next couple of moments. Diane, you're live.
Thank you very much. So my last question, and I believe the Minister Wilson did answer it, but everybody feels this way. I think, it seems too many Bermudians are still not taking this pandemic seriously enough and going about their business in the usual way, dining outside in busy restaurants, shopping, socializing. What will it take for people to realize that their actions can have life and death consequences?
I don't know if the Minister of Health wants to say that, but the only thing I'll say is, go ahead, Minister of Health.
I was going to ask Diane if that question was addressed to you. I didn't hear the beginning of the question.
Oh, my apologies, Minister. Should I repeat it?
Yes, thank you.
I'm happy to take it, Minister of Health. The thing is, Diane, that what we're seeing right now, I can state that it is now becoming real to many people. And it should have been real before, when there was the first wave of deaths and the second wave of deaths. But now it is clear to all that this is a deadly virus that can have serious impacts on families, communities, and certainly our healthcare system. And it's not about going about dining and shopping, because dining and shopping must happen. It's just about making sure that we follow the public health guidelines that are in place. If we are not well, stay home. Take advantage of the opportunity to find out about your status and make sure that you protect yourselves. That's what's important. And so I think that there's a great many people who would have said that this was not real before. Now it's personally impacted them and their families. And it shouldn't have had to come to that, but that's where we are. And my hope and belief is that, and we're seeing it insofar as the numbers, is that more people will take it upon themselves to go ahead and protect themselves, ensure that their family members, especially their senior citizens, are protected. As you heard Dr. Miller speak about how this virus affects those persons, that are older years. I mean, we reported 10 new deaths yesterday and 7 out of those 10 were people over the age of 80. It's vital that we're doing what's necessary as much as we can to protect our seniors. So I think that it is hitting home for most. And if the situation which you stated about earlier, about a morgue that's overfilled and having to use refrigerated containers doesn't hit home, then I don't know what else will.
Thank you, Premier.
Thank you, Diane.
Thank you, Diane. We're going to try to do this rapid fire. How's that? Maya Palacio, Media Maya. That's your one question. Maya, you're live.
Thank you very much for letting me have one more question. My question actually to you, Premier, you mentioned earlier about, I'm not sure if it was an example or a story of a family and they had an elderly person in their home who did not get the vaccine or was over 9 years old. And my question will be, is there an option for persons who are in similar situations who cannot leave the home or can't physically drive to get persons to come to their house to give them the vaccine? Or is that an option to at-home vaccines?
I see the CMO shaking his head, so I'll let the CMO take it.
Okay.
Yeah. Minister, I'm happy for you to take it if you want to.
Thanks, CMO. And I saw you shaking your head, and I was shaking my head. We were both shaking our heads simultaneously. Yes, Maya, there are, we've been doing homebound immunization since we started this campaign. So the family member can contact the vaccine hotline and or register online, and we will make arrangements for somebody to come to the home to vaccinate the loved one.
All right. Thank you very much.
All right. Thank you, Maya. Media Maya. We'll go to Jonathan from the Royal Gazette. Jonathan Bell. All right. You're live, Jonathan.
Thank you, team. Can folks hear me, please? Yes.
You're live. You're good.
Just quickly, this would be one for yourselves, Doctors Ayo and Miller. Strictly from a medical perspective, I guess, should Bermuda be imposing more restrictions in order to slow down the spread of this virus? Again, strictly from a medical perspective.
From a medical perspective, it's not so much restrictions at this stage. It is really following the public health guidelines, and really taking up the vaccination. For instance, there are people who say, oh yeah, we should shut the airport, we should shut everything down. But let's look at the reality. The reality is that the COVID is widespread in the community. And in fact, the more recent data which the ministry will put out is that if you look at each day, we're not getting the majority of cases coming from abroad. Those, we are getting them from within Bermuda. So if you were to shut the airport at this point in time, we would shut off business, we would shut off some food and some other supplies, but we wouldn't really significantly affect the numbers. And if we did that and did nothing else, and people went partying and having a grand time, and being on the beach, because there's a misconception that people will believe that if you're outside, but you're close to each other for a prolonged period of time, you won't transmit the virus. No, if you're in close contact for a prolonged period of time, then it's going to be very much like you're indoors. So there is that risk, and if people are going to be close together, they should be wearing their mask, especially if they're from different households. So that's really the sort of thing. There are enough guidelines, enough advice, and the most important thing in terms of us getting to where we would like to be is for the population to be vaccinated. But certain restrictions helped us from the hospital side in that For instance, by knowing that we're less likely to have the polytrauma from a road traffic accident that tend to happen late night, early morning, the 12 midnight, 1 a.m., 2 a.m., 3 a.m. accidents. Because when those come in, they take up a lot of resources. Those people need to use the ICU, the operating theater, so they will be taking up facilities that we desperately need to look after other ill patients. So that sort of measure does help, while at the same time, it enabled most people to carry on their legitimate commercial activities so that life goes on near normal. After all, it's become fashionable, not just here, but in much of the world, that young people now go out 12 midnight to party until daylight. I don't mind them doing that when everything is all right, but this is not the time to do that, because they do that, they get into accidents, and we've had some horrendous accidents that come in that time, and they have serious polytrauma, and they take up a lot of resources. So if by having that in place for another 2 weeks, I'm particularly delighted, and I know the hospital doctors will be, to hear that that curfew will be on for another 2 weeks, because we anticipate that certainly over the next 2 weeks, we will still have a challenge in terms of our patients in ICU, because what tends to happen, sometimes the patients who go to ICU stay quite a long time. So anything that will not add to the demand on ICU bed and the operating theater, we appreciate that. But in terms of measures for COVID itself, the most important thing for people is to go out, get vaccinated. Also, wear the mask appropriately, not around their neck, as I see still too often. Wash their hands frequently and follow the guidelines on social distancing.
If I can just add to that, thank you very much for that excellent introduction, Dr. Miller. 15 years ago, I participated in a seminar. We talked about public policy as if health mattered. And part of that discussion was a discussion around public policy as if only health matters, which is healthism. Everything is subsumed in health. And that is almost as bad as having public policy as that does not consider health. And so going to your specific question, yes, there is evidence from our third wave that if we had shut down the island, that things would have dropped exponentially at some point in time from our third outbreak. However, to what effect? Because as Dr. Miller said, the most important thing for us to do is to get our population vaccinated and our population protected from this. So if we shut down now, we will still end up, we will still end up facing that same question. And our roles as public officials is to give advice to the elected members of our government who have an overview of what's going on in the population, and as if health matters, but not only health. They have the overview of what's happening across the economy. So absolutely, yes, it could help, but the downside of it is that we're kicking the can further down the road.
Got it. Thank you, Doctor.
And thank you. Thank you, Jonathan. Thank you, Dr. Ayo. We're going to allow Trevor to come on in and get one last question. Trevor, you there? Great. Thank you, Trevor.
Yes. My final question. Has the government, what's the understanding of this monoclonal fusion injection? Is that any thought of having that medication brought to Bermuda? Premier, Minister of Health?
I'll let the medical expert speak on that.
Trevor, we have looked at it here at BHP, and in fact, we have put in an order. Sourcing is a bit of a challenge, but I appreciate you asking that question because I've seen a little bit of misinformation regarding that, where people have put it forward as though if only we had monoclonal antibodies, everything would be all right, everyone would be alive today. Nothing could be further from the truth. It is relatively new, and in fact, I must say very new. And the limited data which is available shows that the place that it has is in pre-hospital treatment. You know, it is with an aim of keeping people out of hospital before they get very sick. You have to treat at least 10 people to keep one out of hospital. But there's another side to it. How do you know which ones you're going to treat versus which ones you're not going to offer? And if you were to offer it to everybody, it would only keep a small amount out. So it has a place, and we have placed an order, and as soon as we get it, we will have to refine a policy as to who will be the ones, how we select out who we should give this to. But it's not a sort of magic bullet. It's not going to cure the person who comes in with pneumonia, blocking out both lungs, their kidneys and everything else shut down. We're still going to have to take those who can't keep their oxygen levels up, take them, admit them to the wards, or in some instances, straight to the intensive care unit. For those ones, the monoclonal antibodies won't solve their problems. So it is something useful in the armamentarium, but if you were to look at the two most useful things in terms of modalities of treatment, it would be having appropriate oxygen, high flow oxygen, and having steroids, dexamethasone. I'm pleased to report that at BHP, we did double our capacity to deliver oxygen to the extent that when a nursing home ran into a little bit of difficulty, we could, without batting an eyelid, offer them some. And we have been able to offer to ships that have passed by in distress. So we're in a good place where oxygen is concerned. We're in a very good place where dexamethasone is concerned. And those are the two mainstays. The other sort of things which we use, we also have adequate amount. Our challenge really, as I've said, for BHP is with staffing. Space, we can create more space, and we have created some space in terms of even having extra ICUs. We created 2 satellite ICUs, as you know, and we have extra bed space for COVID patients. So sometimes I hear a worry, will we have to put them up at the Lamfogo, or will we have to put them at the camp or elsewhere? No, we can accommodate numbers here. We have the contingency plans. As I said, we have an A, a B, a C, and a D, and an E. So we have planned it out. The real challenge that we have is with staffing, but the monoclonal antibodies, we have ordered some, and when it comes, we will use it.
Thank you.
And thank you, Trevor, TNN. And that is bringing us to the end of our questions from our reporters. We'll now turn it back to Premier Burt, for the final remarks.
Thank you, Ms. Evans. I just want to certainly thank the Minister of Health for her continued work, energy, and effort, the CMO and all of his staff, and certainly Dr. Miller and your teams over there at the Bermuda Hospitals Board. Vision to all frontline staff who continue to work during this outbreak. I please will ask all persons to continue to obey public health guidelines and listen to what has been stated inside this press conference, the advice from our trusted medical experts to ensure that if you do contract a coronavirus infection, you are doing what is necessary to keep you and your family safe. Let's all do our part and let us all continue to pray for the families who are grieving at this point in time as this wave has certainly taken its impact on our collective community here in Bermuda. So I want to say thank you to all persons and have a wonderful afternoon.